there, very good evening and a warm welcome to the news live on Rupavahini Channel I. I'm Sharon Mascarenhas.
A very good evening, I am Dishan Veerakone and we start off by taking a look at your top stories for tonight. 640 more persons have been fully recovered from the COVID-19 disease. The total number of fully cured patients exceeds 10,000. The President instructs to focus special attention on corona threats on patients having non-infectious diseases. Travelling to other areas from the Western province has been banned till midnight on the 15th of this month. The World Health Organization says a vaccine against corona could be produced by the beginning of next year. Reconstruction of the historic Digavapya Chaitya begins. The Mumbai Indians team, coached by Mahela, secures the IPL trophy this time as well. Biden prepares to assume duties in the presidency, disregarding challenges from Trump. Now starting off with your top story for tonight, resident representative of the WHO in Sri Lanka, Dr. Razia Pense, says a limited number of COVID vaccine doses are expected to be available for vulnerable groups in countries during the first quarter of next year. She further said that the behavior of the public would determine the trajectory of the viral outbreak, as Sri Lanka is at a critical juncture in the COVID-19 prevention process.
Currently, around 200 candidate vaccines are at some stage of development. Of these, at least 47 candidate vaccines are in human trials. About 10 of these are in phase 3 trials. So we have a very robust pipeline. The more candidates we have, the more opportunities for success. Phase 3 trials of some of the candidate vaccines began in July 2020. We expect that the results of these trials will come at the end of the year, and possibly some results may come by November. After the data is available, regulatory authorities will need to assess the safety and efficacy, and then the manufacturing for approved vaccines will begin. Given this timeline, we expect that the doses would begin to arrive in countries by middle of 2021, around second or third quarter. A limited number of vaccine doses may be available starting the first quarter of 2021. As of 29th October, 186 countries and territories are engaged in the COVAX facility. These include 94 self-financing upper and high-income countries and 92 low and middle-income countries. Second group of countries will be supported through the Advanced Marketing Commitment, and this facility will allow the countries to cost share for the COVID-19 vaccine. Sri Lanka is signed up to the AMC facility. As initially the doses of the vaccine would be limited, these would be prioritized for vulnerable groups like health workers and elderly population. For this, WHO has developed a fair allocation framework. This will happen in phases. So phase 1, an initial proportional allocation to all countries, where they will progressively receive doses until all countries reach 20% of their population. The phase 2 will be an expanded coverage to other population groups, and if severe supply chain persists, then a weighted allocation approach would be adopted, taking into account the country's COVID threat and vulnerability. And while the country awaits delivery of vaccine doses, it is important to have a national plan for the deployment of COVID-19 vaccine that would include prioritization of population groups, mechanisms or platforms for delivery of vaccine, health system requirements, regulatory requirements, vaccine safety monitoring mechanisms, communication strategies, and budgeting and financing framework for co-payment of these vaccines. Safe and effective COVID-19 vaccine is still a few months away, and it will be even longer before it is available to a large number of people. That's why it's important that we continue using the public health tools and measures that we know are effective in preventing the infection and breaking the chains of transmission. Sri Lanka is currently seeing a resurgence in the COVID-19 cases coming from a few clusters. The Ministry of Health, with support from the Triforces and the intelligence, is working hard to contain the spread of the virus. The country is at a critical moment in the pandemic response. The way we act and behave now will determine the trajectory of the virus. Now, more than ever before, Sri Lanka needs a whole of society and whole of government approach.
That was the resident representative of the World Health Organization in Sri Lanka, Dr. Razia, giving her remarks. Meanwhile, the chief epidemiologist, Dr. Sudat Samaravira, says that an experts committee has been appointed to investigate into all the deaths related to COVID-19 within a period of 1 week. He also said that a study report on the usage of antigen testing in the country is expected to be submitted as well. He made these remarks in a media briefing held in Colombo today.
In the recent past, we have seen that there is an increased number of deaths reporting that is associated with COVID. Sometimes these deaths could be due to the direct influence of COVID, like having pneumonia because of COVID, as well as there could be some people that who are having chronic illnesses that is been having death due to COVID or contributing COVID to the existing diseases. But sometimes that it could be an coincidental or accidental combination. Even though the person who is dying is having COVID, that COVID infection may not be contributing to the death. So because of that increase in number of cases, and also that how that COVID has influence over all these deaths, and also if this death occurred at home or somewhere else, whether there is any delay from the health services or whether there is a delay in the health seeking behaviors among the people, and also whether there are any errors that can be rectified. It is needed to be analyzed and understand. The Director General of Health Services has appointed an expert committee to investigate into all the deaths and to submit a report. We expect that this report will be ready by 1 week time, and that this committee that includes a medical administrator and also judicial medical officer, a consultant, and also consultant epidemiologist. We hope that we will get a very good analysis end of the 1 week time. Everybody is expecting or eagerly waiting to use rapid antigen test to detect COVID. When this type of test comes into a country, it is necessary to analyze or investigate or do research to see whether that this test will give the expected results. That is, that it will give us correct information about COVID infection in the person. If it is not giving the proper results, what will happen is a COVID infected person may provide results as that he or she is not infected, so that he will be roaming around in the society that is spreading the disease. On the other hand, a totally healthy person will come as a COVID infected person. So because of that, we will need to admit him or her until that for 14 days at least, and as well as that all the people that has to go quarantine, most of the people that associated, so that it is a cumbersome thing, and also there will be a cost to the government. So because of that, any test if it comes, it should give us the correct and accurate, precise results. So because of that, this investigation, this analysis is being done by consultant virologist, and a report will be submitted to the Secretary and the Director General of Health Services. With this study report, the epidemiology unit will be able to recommend to which categories that this test can be utilized, and through that we hope that the rapid antigen test we will be able to use in our country very soon, very accurately and precisely, that identifying the most suitable groups for this test.
Welcome back. The National Operational Center for the Prevention of COVID-19 Outbreaks says the number of COVID-19 related recoveries in the country has increased up to 10,183. A total of 646 COVID-19 patients were discharged from hospitals following their complete recovery today. Another 40 COVID-19 patients directed to Polonnaruwa, Valikanda, Poonani and Gallela COVID-19 intermediary treatment centres left the centres following complete recovery. The patients were identified as residents of Colombo, Gampa, Kandy, Nuwara, Ampara and Kalmune districts. Director of the K-Gol General Hospital, Dr. Mihira Priyangani, says that another batch of 16 patients at the COVID-19 treatment centre in Pinnavala have fully recovered and left the centre. 4,096 COVID-19 patients have fully recovered in the past 7 days in the country. 657 fully recovered patients have left yesterday. A further batch of 646 recoveries were recorded today. So far, a total of 10,182 COVID-19 patients have been fully recovered, as the percentage 67.77, and the percentage of patients continuously receiving treatment is at 31.92. 309 COVID-19 patients were identified today. They were all close associates of the Paliagoda COVID cluster. Another 646 patients connected to this cluster were fully recovered and left the hospitals today. Meanwhile, the 42nd COVID-19 related death were reported from Panadura today. The victim, an 80-year-old male, was reported to have died before admission to the police hospital. At the post-mortem, the cause of the death was attributed to a heart attack occurred due to the affliction of the COVID-19 disease. Final rites were conducted according to quarantine laws at the General Cemetery, Borella, today. Meanwhile, a 40-year-old resident of the Colombo 11 has also died upon admission to the Colombo National Hospital. Another 45-year-old male of Kelaniya also died due to the COVID-19 disease. He was undergoing treatment at the Hambantota District Hospital since the 1st of this month. 272 persons stranded in Dubai have returned to the island at dawn today. They were subjected to PCR tests at the airport and later on brought for quarantine. 49 Indian nationals employed at a hotel construction in front of the Golf Face Green, Colombo, were also reported to have been afflicted with the COVID-19 disease. Around 200 workers at the site were isolated at their places of lodging in Ratmalana. Meanwhile, 43 employees in a garment factory in Gurugoda, Horana have also contracted the COVID-19 disease. They were sent to a COVID-19 intermediate treatment centre belonging to the same garment factory located in Koggala. A special operational evaluation committee of the Health Ministry appointed to take decisions regarding special action to be further implemented to control the spread of the corona pandemic has met today. Minister Pavitra Vanniyarachi has presided over the meeting. Attention has been focused on the direction of the COVID patients to appropriate hospitals based on their health conditions, and also on the identification of more hospitals on the divisional and district levels for further COVID-19 treatment, as well as on the provision of necessary medical facilities. The need to enlighten the hospital staff on coronavirus through internet technology was also discussed. The Central Environmental Authority has introduced a guideline on the disposal of face masks and other refuse used by persons undergoing quarantine in isolated areas. Instructions have been handed over to the local government institutions previously on the disposal of clinical garbage in isolated areas using alternative vehicles and employees. The face mask and gloves used by COVID-19 patients should be separated and placed in yellow color bags. Such bags should not be subjected to recycling but destroyed to a proper procedure.
In the meantime, President Gotabaya Rajapaksa has instructed the COVID task force today to focus special attention to rescue those who are having non-infectious diseases from the COVID infection. The President has also reiterated that all regional pharmacies in the island should be made fully active without the least possible delay. The doctors have pointed out that, as in the case of other countries, the reason for 93% of COVID-related deaths in Sri Lanka was due to the affliction of the virus to those suffering from non-infectious diseases. Patients with heart, diabetic, kidney and cancer diseases are reported to be infected more speedily than other patients. It has also been pointed out that many patients die without showing any disease symptoms. However, PCR tests conducted later on have found out that they were COVID-infected patients. Therefore, the President has advised relevant officials to implement a special program to enlighten these patients on their conditions. The President said that hardships faced by the people to gain access to major hospitals should be recognized. He has also emphasized that the regional dispensary system across the country should be made fully functional as soon as possible. The President added that required resources such as doctors, nurses, midwives and other professionals should be provided to these hospitals expeditiously. The President added that it should be continuously monitored whether current methodologies are being followed in distributing goods to isolated areas. Instructions have also been given to the security divisions not to allow any person to either enter or leave such areas. The President has also inquired on the situation in prisons and measures taken to prevent intrusion of the virus into these premises. He has also ordered security divisions to take measures to prevent travelling to outstations from the Western Province, where a higher number of COVID-infected persons have been detected. Ministers Pavitra Wanyarachi and Keheli Rambukwella, parliamentarians Premnath C. Dolawatta, Pramita Bandara Thenakone, as well as members of the COVID task force have attended the discussion.
It has been banned with immediate effect for any person to travel to outside from the Western Province. The National Operational Centre to Prevent the Spread of the COVID-19 disease says the order will become valid till midnight on the 15th of this month. The police says 27 police divisions, 5 Grama Seva divisions and 5 multi-storied housing complexes in the Colombo city continue to remain isolated. He further says that only those who are engaged in essential services are permitted to enter such places.
At the moment, the quarantine curfew is not in existence. However, 27 police areas have been locked down. In addition to that, 5 Grama Seva divisions have also been locked down. So no one is allowed to go out from the lockdown area, and apart from that, no one is permitted to go into lockdown area under any circumstances. However, the employees or the members of the essential services, they can perform their duties within the lockdown area, and apart from that, the essential items could be transported to lockdown area from other areas. It is permitted. However, the inmates of the area, they should be at home, but in case of exigency, if they are having chest pain or pregnant mothers or the children, they are having various types of sicknesses, so they are allowed to go to the nearest police station with any transport mode, with any permission. They can proceed to hospital, and apart from that, a special number has been introduced. They can call the 1999 or any other number introduced by the Health Ministry to get an ambulance service to proceed to the nearest police station, nearest hospital. So therefore, that facility is there. The essential services are operated in the lockdown area. The employees of the essential services are permitted. And apart from that, the inmates who are having various types of sicknesses are permitted to proceed to hospitals. So that is the situation in lockdown areas. And apart from that, about 600 police officers have been found as COVID positive cases, and approximately 3,000 police officers are following quarantine procedures, and they have been kept in quarantine centers, 5 police quarantine centers. So the COVID positive cases are found from the officers who have been kept in quarantine centers as the results of regular PCR test. However, we have controlled the situation inside the police organization, and we have 90,000 police officers. So 87,000 police officers, they are in the field and no one is positive, and 3,000 police officers have been isolated and they are in quarantine centers. All the positive cases are being traced from the quarantine center. So that is the situation in the police. Apart from that, we would like to make a request from the general public. Sometimes you might be in a lockdown area, or you might be living or staying in non-lockdown area. But all the time, wear a face mask, keep the social distance, and obey with health rules and regulations and customs. And your support and assistance are needed to eradicate or prevent spreading of COVID-19.
The State Ministry of Transport requests all bus owners to suspend the arrival of buses to the Western Province or bus transport from the Western Province till midnight on the 15th of this month with immediate effect. Meanwhile, the Sri Lanka Department of Railways says that trains will be deployed only up to the locations on the final boundary of the Western Province tomorrow afternoon. Accordingly, passengers are allowed the opportunity to travel to Alutgama, Ambepussa, Kochikade and Avisavela from Colombo. The department communique further said that train journeys commencing from Beliatta, Kandy, Mahava, Puttalam and Avisavela are scheduled to reach Colombo Fort Railway Station by tomorrow morning. Prime Minister Mahinda Rajapaksa has presided over the historic Digavapiya Chaitya reconstruction today. Digavapiya is regarded as the prominent site of the Buddhist worship in the Eastern Province according to religious significance and land extent among the Solasmasthana sacred veneration sites. Several attempts to reconstruct the sacred site during the past few decades have failed. The area had remained abandoned for a long period due to the natural and human activities. Prime Minister Mahinda Rajapaksa, upon arrival at the sacred Digavapiya Chaitya, was engaged in religious observances amid spirit chanting by the Mahasangha. The reconstruction is scheduled to be completed within 2 years through the labours of the three armed forces and the Civil Defence Task Force under the guidance of the Department of Archaeology. Chairman of the Presidential Task Force on Management of the Archaeological Heritage in the Eastern Province and the Secretary of the Defence, retired Major General Kamal Gunaratne, has made preparations to construct a resting hall for the devotees arriving to venerate the Digavapiya sacred site. Prime Minister Mahinda Rajapaksa has planted a Na sapling to symbolise the reconstruction of the Puja Bhumi. Processing of the pinnacle and the Chudamanike of the Digavapiya Chaitya as well as the construction of the Vihara gear are being conducted through the patronage of the financial contribution of the Chief Sangha Nayaka of the Na Uyana Aranya Senasane, the Venerable Angul Gamue Aryananda Thera. A cheque valued at 76 million rupees was handed over to the Prime Minister by the Board of Trustees of the Na Uyana for the reconstruction of the Salapathaluma and the Sandahirusaya Vihara. Among those who graced the occasion included the Mahasangha State Minister Vimalavira Dissanayake, Parliamentarian W.D. Veerasinghe, Governor of the Eastern Province Anuradha Dayampath, Defence Secretary Major General Kamal Gunaratne, Secretary to the Ministry Buddha Sasana, Religious and Cultural Affairs, Professor Kapila Gunawardena, Director General of Archaeology, Professor Senarath Dissanayake, Director General of the Department of Civil Defence, retired Rear Admiral Ananda Piris, and Chief of National Intelligence, retired Major General Jagat Alvis. Prime Minister Mahinda Rajapaksa was also engaged in an inspection tour in Mudama Vihara in Pothuwil. There had been a tremendous uproar during the period of the previous regime regarding the encroachers grabbing land belonging to the Viharasthana. It has been disclosed during the visit of the Prime Minister that measures are underway to resolve the dispute by marking the boundaries of the Mudama Vihara and issuing relevant licenses declaring the land as a sacred area. The Prime Minister also visited the tourist zone of the Arugambe today.
Now, President Gotabaya Rajapaksa has directed instructions to 10 companies involved in the construction industry today to take necessary measures to build more than 36,000 housing units within a 4-year span for the low-income earners. 15,000 houses expected to be constructed for middle-income earners. President Rajapaksa made these remarks during a meeting with the officials representing 10 companies engaged in the construction industry at the Presidential Secretariat today. President Gotabaya Rajapaksa requested construction industry pioneers to commence work on a large number of housing projects simultaneously for the benefit of low, middle and upper middle. The local entrepreneurs in the construction sector are given the opportunity to join this initiative. President further said that it is expected to meet the housing demand of a large number of young people from all sectors, including the executive and entrepreneur categories. For this purpose, commercial banks will provide loans at concessionary interest rates that can be repaid in 30 years.
A memorandum of understanding to implement high-impact community development projects under Indian grant assistance was signed between India and Sri Lanka in the presence of the Prime Minister Mahinda Rajapaksa at Temple Trees yesterday. The extension of the ongoing MOU and HICDP for another 5 years had been announced during the virtual bilateral summit between Prime Minister of India Sri Narendra Modi and Prime Minister Mahinda Rajapaksa in last September. The MOU was signed by the High Commissioner of India to Sri Lanka, Gopal Bagle, and Secretary to the Treasury, S.R. Atigala. Under the high-impact community development projects, a total of 64 projects using a total outlay of approximately 20 billion rupees as aid from the Government of India has been implemented in Sri Lanka. As per the new framework MOU for the third phase, individual development projects costing up to 300 million rupees in social sectors, including health, education, water, sanitation and agriculture, can be taken up in Sri Lanka. The total outlay of all such projects at any given time can be up to 5 billion rupees.
Now, daily trading at the Narayanpeta Economic Centre has gone up appreciably. More traders and dealers are arriving at the centre upon withdrawal of the quarantine curfew. Wholesale traders at the Narayanpeta Economic Centre have been provided the opportunity to engage in transactions without obstruction even prior to the lifting of the quarantine curfew in the Western Province. Essential food items including vegetables were distributed to many parts of the island from the centre. However, due to the close down of the Colombo Manin market, many traders are arriving at the Narayanpeta Economic Centre. All bulk and retail trade are being carried out according to the proper health methodologies. Retail and wholesale at the Ratmalani Special Economic Centre are also being carried out under protective health conditions. Management at the trade centre said the traders are transporting food stocks without any wastage. The items are being sold at reasonable prices. The Dambulla Economic Centre is also receiving harvests of farmers island-wide without obstruction. Traders at the centre have rejected charges of discarding of vegetable stocks at the centre. Infrastructure facilities get underway at the premises of the State Engineering Corporation in Palyagoda, where the Colombo Manin market is to be temporarily relocated. It is hoped to recommence activities of the Manin market from the new location by next Monday. Porters and staff at the Manin market will be permitted to enter the new Manin market premises in Palyagoda only after undergoing PCR tests. DIG Ajit Rohan has said that this measure has been taken to substantiate the fact that they are not be infected with COVID-19.
The Social Infrastructure Facilities Development Committee has given solutions to many problems in the Puttalam district. The committee says that the remedies will be provided to the teacher shortage, one of the main problems in the district from the 1st of January next year. This was disclosed at a meeting of the committee held at the Puttalam Divisional Secretariat Division yesterday. The subject of the meeting was to discuss on the development strategy of the national program to uplift the rural economy. Another objective was to amalgamate the village directively with the joint mechanism of all cabinet and state ministries. Another aim was to obtain proposals on the district level regarding utilization of funds allocated through the forthcoming budget on the development of the villages. The meeting was also focused on attention to decide upon the development programs to be implemented in the district through the respective ministries. It has also been decided to resolve the teacher shortage in the Puttalam district through transfer of surplus teachers in the Kurunegala district. Minister Namal Rajapaksa, attending the discussion, said that a sum of 23 million rupees has been allocated to set up a fully fledged sports school, enabling to produce sports personnel capable of securing national and international level victories within the next year. Attention has also been focused on the provision of a permanent solution to the threat of wild elephants. The minister has pointed out that elephant corridors that have been taken over by human habitats should be released as soon as possible. A decision has also been taken to enhance necessary clinical facilities as a remedy to resolve the existing kidney problem in the area. Shortcomings at the hospitals are to be rectified expeditiously. Other topics that have come under discussion included the recommencement of the construction at the indoor stadium of Joseph Was College, Venapur, and the reconstruction of 5 dilapidated bridges. It has also been decided to establish an MVQ certificate training school in the Puttalam district, construction of a coastal sports garden and develop preschool infrastructure facilities. Ministers and MPs, including Tenuka Vidanagamage, Sarath Veerasekara, Lasanthalavge Vanna, Sisira Jayakodi, Piyal Nishanta, Asoka Priyanta, Priyankara Jayaratna, Sanat Nishanta, Chintaka Amal Mayadunna and Vichita Berugoda and state officials were also present on the occasion.
Now, the Department of Government Information says that relief has been provided to 1,452,954 families undergoing quarantine. The number of families provided with the 10,000 rupee relief package amounts to 43,376. A further 1,409,578 families have been provided with the 5,000 rupee allowance. The Treasury has allocated nearly 8 billion rupees to facilitate the affected groups during the period. 7,500 families in the Colombo district, 7,000 families in the Gampa district and 4,000 families in the Kauthal district have been given the bags of dried food items. Similar relief has been provided to 2,961 families in the Kurunegala district and 2,378 families in the Batticaloa district. 544,254 families in the Gampa district have also received the 5,000 rupee allowance. 466,720 families in the Colombo district and 262,000 families in the Kauthal district have also received the 5,000 rupee allowance. Among other beneficiaries of the 5,000 rupee allowance included 93,914 families in the Kurunegala district, 27,550 families in the Batticaloa district and 15,140 families in the Ratnapura district. And that's a wrap of tonight's primetime news, and until we meet again next time, do take care and good night.